The organizer of this webinar is Tapas Kumar Mohanty, whom we will be hearing from in a moment or two. Tapas works at the King Edward Memorial Hospital Research Centre in Pune in India, and he is also the Informatics and Data Science Liaison Officer for RESPIRE. This year, he was the recipient of a RESPIRE Career Development Fellowship funded by the University of Edinburgh. And the purpose of this webinar is to share some of his learning from the fellowship and also to learn from a group of people in India who have, I think I heard, over 20 years experience each in this area. So to really try and bring all of that together and share it more widely. So who is this webinar for? The focus, as the title suggests, is best practice in data management in health research in India. And as I mentioned, we're grateful to have an excellent expert panel of colleagues from organizations across India who are engaged in health research. But this webinar is just as relevant to RESPIRE members from other RESPIRE partner countries. Because a key aim of RESPIRE is to share learning and experience across countries. Next slide, please. So many of you here today will be members of RESPIRE, but some of you may not be and might be wondering what RESPIRE is. So on the slide here is a very brief summary. RESPIRE is a large multi-country research programme which aims to deliver low-cost, scalable policy and clinical interventions to reduce deaths and the wider health and societal impacts of respiratory disease in Asia. And it does that through its research programmes and supporting platforms. It's co-led by the University of Edinburgh and the University Malaya in Malaysia, and it has 7 member countries across Asia. And again, they're on the slide. They are Bangladesh, Bhutan, India, Indonesia, Malaysia, Pakistan, and Sri Lanka. And the Edinburgh role is in a coordinating and management role in the UK. RESPIRE is funded by the UK National Institute for Health Research. The image on the slide is quite small, but what it shows is that RESPIRE's research programmes are underpinned or supported by 4 platforms. And those are the boxes in the bottom half of the circle. So as I said earlier, I co-lead the Capacity Building Education and Training platform. Tapas works for the Open Science Data and Methodologies platform. Dr. Genevieve Fernandez, whom you will meet later, co-leads the Stakeholder and Community Engagement platform, and we also have a Digital Health and Innovation platform. Next slide, please. So I mentioned that Tapas was awarded a Career Development Fellowship by the University of Edinburgh and RESPIRE, and that this webinar is part of the output of that fellowship. The purposes of the fellowship are outlined on the slide, and this webinar is particularly about the final 2 of these purposes, contributing to institutional capacity building and promoting research networking, learning and collaboration across the different RESPIRE countries and organisations. Next slide, please. So this is just to remind everybody that we are recording this webinar so that we can share it. We share things for educational purposes, for people who couldn't come here today, and also for promotional purposes. So if you know, your continued participation in the webinar will be taken as consent to that recording, and you can find more information about this by the link on the slide, and there's also a QR code if you want to have a look at that. Next slide, please. So here's the agenda for today's webinar. First of all, Tapas and Simon Smith will give a presentation on how to improve research data management within Respire and more generally based on lessons learned from the Career Development Fellowship. I'm sorry about the noise from my emails. I should have turned that off. So sorry about that. So as I say, first we'll have a presentation from Tapas and Simon. And then after that, Tapas will introduce Dr. Genevieve Fernandez, who co-leads the stakeholder and community engagement platform of Respire. And Genevieve will chair a panel discussion with an expert panel of eminent colleagues from a very diverse range of organizations in India. You can see the panel members on the slide. Dr. Misra from Project Concern International, Dr. G.K. Soni from John Snow India Private Limited, Dr. Harpreet Singh from the Indian Council of Medical Research, and last but not least, Dr. Sujit Ranjan from the Tata Trust. And Genevieve is going to introduce the panel members fully at the start of the panel discussion. And then finally, after that, we'll close with some thoughts from Dr. Anand Kawadi from the Vadu Rural Health Programme and Community Health Research Unit at the King Edward Memorial Hospital Research Centre in Pune. So without further ado, I will introduce the speakers for our first session. As I mentioned, Tapas Kumar Mohanty is the Informatics and Data Science Liaison Officer for Respire. He's based at the King Edward Memorial Hospital Research Centre in Pune, and his role is to enhance open data science policy and practice, to support the development of data management plans, and to foster data management collaboration across all our Respire, our 7 countries and our approximately 30 different partner organizations. So it's a very big role. His background and experience make him highly qualified for this role. He has 3 master's degrees and a postgraduate diploma and has worked in the public and private sectors in India and for international organizations in a range of relevant roles. During Tapas' Career Development Fellowship, he visited the University of Edinburgh to spend time with Dr. Simon Smith, whom I'm also delighted to introduce today. Simon's academic teaching and research background is originally in philosophy, but he's worked in research data management for almost a decade now. So he joined the research data management, the open research team at the University of Surrey in the UK in 2015. And in that role, he developed a range of research data management services. He implemented 2 data repositories and focused on data management planning. He came to the University of Edinburgh in 2022, and he is interested particularly in issues around data licensing and sensitive or personal data. So I'm delighted to hand you over now to Tapas for the next part of this webinar.
Thank you, Ruth. Thanks for the warm welcome. And today, me and Dr. Simon, we are both going to present about the lessons that I learned during my Respire UOE fellowship. I would like to just tell that during last month of May and the first week of June, I had been to the University of Edinburgh to learn more about research, data related thing and the data management and privacy things. And I took that opportunity to visit 2 more universities as well, like the University of West of the England and the University of Oxford. So what are the hands-on learning that I learned from the team over there, from the research data management group? It was all about the hands-on experience regarding the tools that had been through the university for various projects, which really helped me to know about the functionality. The first tool was DataShare. It is a kind of open access data repository where the researchers upload their data for long-term sharing and reuse. by anyone who can have the access, I mean, internally, and then it goes to the public domain along with the DOI so that it can be used by any of the research person across the globe. Data Vault is one of a kind of archival system which is meant for the long-term safe storage of the active data and those data which are being kept internally to be accessed by the PIs and the COIs and the research team and which can be referred on a later stage. So how to work on that and how securely we can save the data over there and how it ran through the different login credentials that I learned. And I also got to know about the technical glitches and how to handle those things because we are supporting all the researchers in 7 Southeast Asian countries, how to keep safe and keep the privacy of the data. And there are certain data which should not be shared openly. So for the active data, they are going to use the data vault. There are other services called data store and data sync. These are Dropbox kind of tools which helps the data, seamless data sharing with a secure mode within the research team and which is connected with the Pure, which is Pure is the university's information system where all the researchers' information are kept and which can be linked with all these tools so that it is easier to find the team behind the research studies that are being ongoing. I took this opportunity to attend 2 of the conferences. One was held in the Edinburgh Open Research Conference, and the venue was in a conference center where I had presented one of the open science hardware project, which where we are replicating over here in KMHRC Vadu. Another conference that I attended was the Impact Festival, where the international collaboration and partnership, since they are different partners for RESPIRE who are working in 7 Southeast Asian countries. And from Malaysia and Bangladesh and Diksha from India, they have highlighted the impact of sustained collaborations. I could able to meet the other team members in the University of West of England, where I had done one of the virtual course about data governance. It was an 8 weeks course, so I supported them to make one of the overarching data governance plan of RESPIRE 2. So I could able to meet them, and we have shared some ideas, and we want to make some kind of group where we can share ideas further. The second meeting was with the ISARIC. ISARIC is based in University of Oxford, and they are working with Emerging Infection Consortium. So they have made some kind of ECRFs which helps to have a disease outbreaks, including dengue, because since last we have seen the COVID-19 emerges as a big pandemic. So they are also working with community engagement activities on outbreak related stigma. So what are the way forward? So we are focusing on the improved data management and open science practices within RESPIRE projects. And from this webinar, we are going to establish a methodologies network with platform 1. My colleague Zinibi is there. So then we can take it further by taking the guidance from different stakeholders and mentors after knowing the best practices, and we can have meetings with all those stakeholders to have further guidance. So these are some of the glimpses that I could able to meet. So Professor Harry Campbell, who is the co-director of RESPIRE, so I could able to meet him. We had a nice discussion. And Kerry Biller, who is the open research specialist at the University of Edinburgh. Christopher is the platform 3 lead who guides me about open science and methodologies. And besides this, Tathagata Bhattacharya, who is based in India, he also guides me. He is the co-lead of platform 3. So I would like to hand over to Dr. Simon Smith to reflect on my learnings that we both worked there. Thank you.
Try that again. Thank you very much, Tapas. So my role in this whole process has really been to support Tapas from a research data management point of view, to ensure that he is as well equipped as he can be to provide data management support to all of the Respire partners. I will say from the top that has been, from my point of view, an incredibly easy job, because Tapas is very good at what he does and is incredibly well prepared. My contribution's actually not been particularly significant. Couple of things I would just like to say about Tapas's visit. Obviously, firstly, it was absolutely wonderful to have him join us. It was a great pleasure to be able to speak face to face and to be able to make that kind of more human connection, which is a vital part of what we do to build those relationships, those working relationships. And to be able to do that face to face was incredibly, it was a great pleasure, but it's a very, very useful, helpful way of doing business. It's much better than having to do this online all the time. I think primarily the thing that struck me most about this was the focus, Tapas's real focus on the tools that are needed for progressing data management and open data for the Respire project. Having really got a handle on the data management planning side of things and the actual development of metadata templates and all the practical day-to-day stuff, moving towards the final stages of the project, looking at depositing data. This is one of the big practical challenges for the project, because obviously data will be deposited here in Edinburgh, and practically that's quite a complicated thing to do. But I think Tapas has clearly got a full grasp of the workflow, having been able to see the workflows, on site, as it were, and be able to work through the systems and see how everything fits together. I think you're in excellent hands, and I think this is a excellent preparation for those final stages of the project. Obviously, we will still be here to support the project, but I think you're in excellent hands. It's going to go fine. I have full confidence that this is going to be a very straightforward process. It's particularly when it comes to concerns around sensitive and personal data. I know this is something that Tapas himself is very focused on, making sure that the kind of data that is made available, only the kind of data that should be made available is made available. So he has a full grasp of that workflow, and it was good to see be able to work through those with him. And that that ultimately, that's my final reflection there, is that this is something that Dr. McQuillan said right at the beginning. This is about sharing and learning across countries, and that goes for us too. I mean, it's been a really useful experience to work with Tapas and to get his insights into working in a completely different environment. That's very valuable for me personally, because we obviously do work with researchers all over the world, but it's also it's been incredibly valuable for my team to have that additional insight and expertise brought to us. So as a knowledge exchange experience, I think it was incredibly valuable. So we were very pleased to have Tapas join us. Everybody was very happy to see him, and his contribution at our conference was absolutely fabulous. So we're very grateful, and hopefully we will see him again at a future date.
Thank you, Simon. Thanks for the wonderful words, and I'm also wishing that it will happen soon, so we'll get another chance. So going forward, I am handing over to GVB for the panel discussion. Thank you.
Thank you, Tapas and Simon and Ruth, for all the for setting the stage for this panel discussion. My name is Dr. Genevieve Fernandez. I'm a public health researcher working with the RESPIRE team I've worked in India, across states, and in South Asia, and currently in RESPIRE, I lead the stakeholder engagement work, and I'm really pleased to be part of this panel. Now, we have an absolutely esteemed list of panelists here today with us, as you can see on the slide, and I will introduce them very soon. And just to give everybody a sense of what's going to happen in the next 45 minutes, we've only got 45 minutes, and I will introduce our speakers, and then I have about 4 or 5 big questions that we've got from our experiences in RESPIRE that I will ask each of our panelists in the order that they've been listed here: Dr. Amrita Misra, Dr. G.K. Soni, Dr. Harpreet Singh, and Dr. Sujit Ranjan. And after we've had these questions for about 45 minutes, we'll then open up to the audience members. We've got about 15-20 minutes for a Q&A. So please feel free to note down your questions and share them in the chat box, as well as raise your digital hand and ask your questions to the panel, and Tapas and I will moderate that. So without further ado, let me introduce our fantastic panelists. We have with us Dr. Amrita Misra, who is a physician, community medicine MD. She's got 2 decades of experience. She's currently the director of health and nutrition at Project Concern International India. And she has worked, as I said, for 2 decades on maternal, newborn, child health projects, covering adolescent health as well, nutrition, WASH, and infectious diseases. And she has served as a technical advisor for several influential organizations, including the Ministry of Health and Family Welfare in India, JSI, UN agencies, including WHO. We also have Dr. Gopal Krishna Soni, who is from John Snow India Private Limited. He is currently the project director of the Momentum Routine Immunization Transformation and Health Equity Project. Dr. G.K. Soni is a physician as well, again, with more than 2 decades of experience in public health with a focus on immunization. And again, he has played a very key role working with the central government of India, as well as 18 states or more in the rollout of the COVID-19 vaccinations, as well as various other flagship immunization programs in the country. Then we're also very pleased to have Dr. Harpreet Singh with us, who is a biostatistician and has got, again, more than 2 decades of experience in this field. And he's currently the program officer of digital health and bioinformatics at the Indian Council of Medical Research. And apart from managing large scale research projects in the country for so many years, he's also played a key role in establishing data systems, played a significant role in policies, several publications. So we're very pleased to have you here, Dr. Singh. And finally, we have Dr. Sujit Ranjan, again, bringing in more than 2 decades of experience in the field of nutrition, public health in India. He's worked with several international NGOs in India, and currently he is part of the Tata Trust. He's the director at Tata Trust. So welcome, Dr. Sujit Ranjan. I was told that Dr. Sujit Ranjan may not be with us right now, but he would join. Join soon. So let me open up the panel discussion then. If I can ask everyone in the room here, what does data management mean to you? What does good data management look like? And if I can ask every panelist to maybe spare 3 to 4 minutes for your responses, so that we can get through as many questions as possible. So over to you, Dr. Amrita Misra. You know, what does data management, what does good data management look like to you? Can I check if Dr. Amrita Misra is in the Zoom meeting, and if you can please unmute?
I think GDB C was there, but I don't know. C might have dropped, but C can join soon.
That's fine. Dr. G.K. Soni, if I can ask you this question, what does good data management look like to you?
So thank you. Thank you, first of all, for organizers for inviting us on this esteemed discussion. And it's very important and critical. I think data, everyone knows, it leads to all actions. If the data is correct, then the actions will be correct. If the data is not correct, then will lead to incorrect decisions, and decisions which are not in the favor of the program will go. So basically data management, what I am able to share as of my personal feelings, that the data should be available, readily accessible. It should be have quality, the quality which is required. And we should not collect the vast data which we are not able to utilize. So how to utilize that data and how to analyze, and post analysis, it should lead to some actions. So there should be quality of data, availability, accessibility, and utility of that data, and easily retrievable. Large dump of data is available and we are not able to retrieve it and we are not able to utilize it. That is the waste of the data. So data collection is very important. What is important, the outcome, what is important for that data should be collected. So for my understanding, I think it should be a quality data which is available, readily available and accessible to all for actions, needful actions to be taken for the program point of view. Over.
Thank you, Dr. Soni. Dr. Harpreet Singh?
Yeah, thank you, Dr. Genevieve and Dr. Soni. In fact, you have hit on the essence of what is data management. So what I would like to add here is, for me, data management includes two aspects: structured data collection and responsible data sharing. So these are the two aspects which means data management, because both these aspects covers the FAIR principles. So by structured data generation, I mean we should have a good data management plan. We should have a good data collection plan, data collection tool. Data collection tool should have compliance with the standards, standard ontologies, semantics, vocabularies, so that the collected data can be disseminated, can be reused by other researchers in a kind of efficient way. And by responsible dissemination of data, I mean that the data should not be available, should be available, but should not be available freely, openly. There has to be categorizations of the data. It's not that all data can be made accessible. There has to be proper categorization, and there has to be a team associated for categorizing the data, whether the data can be put up on web or whether can be accessible through authorized mechanisms or cannot be shared. So there has to be a structured, responsible data dissemination mechanisms. So this is what I mean by data management: structured data collection, responsible data sharing.
Thank you, Dr. Harpreet. And I've been just told that Dr. Amrita Misra has been able to join the meeting. So Dr. Misra, welcome to the panel. And we've just started with the first question of our discussion. What does good data management mean to you? What does it look like to you? If you're able to give us your response to this.
Yes, thank you so much. I am really sorry. I'm in the field and the connection is really poor.
No worries.
I hope you're able to hear me.
Yes, we can. Thank you.
Yeah, so the connection will come and go, but let me just quickly respond to your question. I think Dr. Soni and Dr. Harpreet have very clearly and very succinctly mentioned what data management really means. Quality is, of course, the most important component of any data, and it is something that a lot of us face this challenge of data quality, particularly when it comes to primary data, because this is data that we are collecting by ourselves for any kind of research or any kind of activity that we do. So data can be acquired from secondary sources or primary sources, and secondary sources in this country are becoming more and more difficult, and it's something that we don't really have control on. So we need to then improve upon our primary data collection. And one of the things that we have seen in our organization, we are an M&E, we have a very strong M&E team in our organization. And one issue that we have noticed with our data collection is that when a lot of agencies like in the development sector, we tend to hire data collectors when we need primary data. So every time you need data collection, one tends to hire an external set of evaluators of data. This is, I'm talking about, let's say a mid baseline or an end line or a midline of your particular project. So when we hire external data collectors, what happens is that the level of motivation and the kind of quality that you may get among these data collectors is sometimes not really up to the mark. Because if you look at project designs, most often data collection receives the minimum priority, and we tend to cut a lot of budget from that particular activity. So how we have tried to mitigate this problem is by onboarding a set of data collectors whom we have nurtured over the last 15, 20 years as excellent evaluators. Go on training them continuously and keep up their motivation levels so that the quality of data that we are receiving from the field is extremely good. Plus, we have this, continuous engagement of the thematic leads in any kind of project. So it's not just random data that we are collecting, but we are continuously looking at the data and involving the thematic leads to who will actually use that data. So is the data actually helping or not helping? That process has to be an ongoing process. And that we are constantly trying to do.
Well, I must thank you, Dr. Amrita, because you have actually opened up my next question about the challenges of data management. I mean, while you have painted a very comprehensive picture what good management should look like, there are challenges, as you're saying, about external evaluators. So I want to ask each one of our panelists, if you can tell us about one key challenge that you have faced in your experience, one big challenge in data management, and how you've gone about in trying to address it. Maybe 3 to 4 minutes per panelist would be highly appreciated. So can I ask Dr. G.K. Soni about a key challenge that you faced?
Yeah, thank you. So I think it's correctly mentioned, the team members have already been discussed, that quality definitely is very important. So the data collection is from the field level for any of the programs. So if the recording and reporting are not correct, the wrong data will be percolated from the base to the highest level, and based on which the decisions are being taken. So the key important is the recording and reporting formats should be understandable by the staff who is entering the data. The data entry should be complete. So first of all is the availability of the data should be there. Then completeness of the data should be there. Then we should have the agreement also. Okay, whether data entered at the different level and the different formats are same or not. Because in the field, the manual reporting system is there. That has been converted or digitalized either at the block level or at the national level or at the district level or at the state level. So the flow of the data in the different recording and reporting formats should match at each and every level. So there are gaps which we have identified during our field visits. Yes, the availability of the recording and reporting format which are standard are not there. Then they are not matching with the different formats at the different levels. That is the agreement which has to be there. Then completeness. If the recording and reporting formats are available, they are not complete. So if the information which is critical that is not available, how to analyze, how to interpret, and how to take actions. And sometimes there is effect of consistency also. The logical pattern the data should follow, that should be there. So we have to see how this agreement and consistency of the document will be there. So we have to check whether it is consistent, what is required or not. It is flowing as per the logical pattern or not. So these are some of the challenges I think which are there in the recording and reporting up to the entry of the data in the system. And that is, I think we have usually seen in the past experiences in the field activities also. Over.
Thank you.
Just to add on this,
yes,
there is a different capacity of the staff to understand these data entries also and analyze, interpret it. So at every level, there is a different capacity of the staff who is engaged for data recording, reporting, data entry, because data operators are different. Then analytics, how the data is to be used, how the data needs to be presented. So I think there are different challenges for the data to take actions appropriately. Over.
Thank you, Dr. Soni. Dr. Harpreet, what are your perspectives on challenges in data management? Sir, if you can please unmute.
Let me start from one step backwards. What are the various, what is the typical research data life cycle? There are 6 essential components. There are different components according to different researchers. So 6 essential components which I think are more important are data planning, data collection, processing, analysis, sharing, and reuse. So of all these 6 components, if you're asking about a challenge, one challenge that I can point out is not using the common standard data management practices, which is happening at everywhere. All researchers at the policy level, at the funding agency level, because I have been working in ICMR since last 22 years. And initially I handled large programs of ICMR, like 20 biomedical informatics centers across the country, ICMR AIMS Computational Genomics Center, and now I'm managing this digital health and AI area, a number of projects, research projects. So I can tell you one common problem with all is that either we do not have standard data management practices, or we are not aware of that, or even if we are aware, we don't comply and follow. So by the standard data management practices, I mean use of, first of all is careful planning of the data. Wherever it is possible, please use nationally, internationally recognized standards. So this is for all the researchers who are collecting data. If they use, then rest of the path is very easy for them. So standards include like your SNOMED, ICD codes and all. If they use, then dissemination is very easy and reuse is very easy. Second, by standard, I mean creation or use of metadata. None of the data source I have seen, very few, I would not say none, but very few data sources which have proper structured metadata along with the data. So you asked about one challenge. So I give you one challenge. We are not using the standard practices in data management, but then there are other challenges at different levels as well. Like you mentioned about infrastructure, because we are very much comfortable in developing centralized repositories, large repositories. We are very comfortable in centralizing the data software development process. So I have myself tried it. I can tell you from my experience, it is very difficult to solve these problems with the centralized development or centralized data collection. So ICMR recently has come up with a policy or comprehensive policy on data health research data management, where we have tried to address these problems. I would say in 2 or 3 weeks, the policy will be out, available on ICMR website. It has been approved by various authorities. So there, these issues have been addressed. It is, you can say, my life's experience with the data, last 22 years of experience with the research data, the challenges, the problems, and the solutions.
Fantastic. And we're really looking forward to that. I think once that does come out, we'd be happy to circulate it, especially among our Indian RESPIRE partners, as well as partners across South Asia for reference and some kind of guidance in this. And I know Dr. Sujit Ranjan has not yet joined this group, but following up on what you said about technology and big data, and I know a lot of our members here, RESPIRE members, are working on large data sets. They're working on cross sites. So there's a lot of data coming, but there's also a lot of technology involved here. A lot of digital components of transferring from manual to digital or using digital from the head start. There's also the entrance of AI. So my question to you is, what are the key things we need to consider with the technology in our background, with the digital and the AI in the background? What are the key considerations for us researchers with respect to data management? How do we deal with privacy? How do we deal with sensitive data? And if there are any ethical considerations that we need to keep in mind when we are working with data, with technology in the background. If I can ask Dr. Amrita Misra to go first, please. So I'll ask Dr. Misra again when she joins back. We know that she's in the field today, but Dr. Soni, if you'd like to share your take on this. Sir, if you can please unmute.
Sorry. So regarding privacy and confidentiality, it is very important, like Dr. Harpreet has already mentioned, the data is not to be accessible to each and everyone. The relevant data which is required at the different forum, at the different actionable points, it should be available for them only. Everyone should not have the access because there is a misinterpretation of the data also. So it is instead of utilizing, I think misutilization is also more for the data if it is readily available for everyone. So confidentiality of data is very important. It should be accessible to only the authorized persons who require that, and based on which some policy decisions can be taken up. So we have to be very confident which data needs to be shared and whom are the stakeholders who are going to utilize this. So there are certain policies and privacy confidentialities, I think, that needs to be taken care before using any data which is there. And the data which is used for in the public domain, I think we cannot interpret each and everything from that. And the backside, there are some information which is relevant to that data and which is accessible only to the certain group of people or authorized officers who can analyze and interpret that for making the policy decision. Yes, so policy decisions have to be there for privacy and confidentiality of each and every data. Over.
Thank you, Dr. Soni. Dr. Amrita Misra, if I can ask you to join in here about, what are the considerations that researchers have to keep in mind when they're...
Sorry, I understand you're asking about data privacy. That's correct?
Yes, data privacy and any kind of ethical considerations, especially when we're using technology and digital modes of data management.
Of course. So data is a very sensitive thing. As you know, I mean, we've gone through some data distortion and some data, let us say, stealing in the recent past from different institutes. So, of course, data privacy is an extremely important thing. And as the government is collecting more and more individual data, creating individual data banks, including health-related data with the Aadhaar ID, etc., these issues will become more and more important. And also the potential or possibility of data leakage becomes higher. So how can technology ensure that data is secure enough, and who has access to data? As Dr. Soni said, that only the people for whom it is relevant should have access. Yet there's also a balance that we need to keep. By just completely stopping access to data, we may be limiting the amount of research or amount of good practices or interventions that some people are thinking of, and limit the ability of people to think creatively on the basis of data. So it's a balance between privacy, how much should be available in the public domain, and how much should be limited. So those things have to be kept in mind while we ensure individual data privacy. So perhaps data analytics can be more available in public domain. Individual data can be hidden away, whereas an analysis can be presented or shared with the public. For example, when we came across the ODF data or the COVID data, we did have some analytics, even though we didn't have individual data. So that analytics is still important for public to understand the country's situation, the health situation, and to plan interventions that may help the development sector, in the development sector. Thanks.
Thank you, Dr. Amrita. Over to you, Dr. Harpreet.
Yes, Dr. Genevieve, it's a, I would say, very important but very common question. Data privacy, ethical consideration, and we have this DPDP Act, which has come into existence and has been approved. So it addresses many questions, this DPDP Act, about the data privacy, how to handle data. But then, the challenge increases with, as you rightly said, there are technological advancements. So this challenge increases manyfold when we have technologies like LLMs, when we have technologies like deepfake, and when we have other technological developments. So the real challenge that I foresee is going to come is real versus synthetic data. We'll not be able to demarcate between what data is generated by the LLM models and what data is actually generated by the researcher. So this will be the real challenge that we are going to face. And there are right now very thin line demarcation between how to differentiate and how to regulate the generation of this LLM based data. So I'm from the health sector, so you can very easily imagine the models which are being used in the hospitals or which are going to be used in the hospitals on patients generated using synthetic data or generated using LLM generated data. So then the ethical question will be, who will be responsible for the damage caused by those models? How you're going to access or address those damages? So what I think, and we have at ICMR started this large scale program, which you can probably find on internet as well, is to develop authenticated, representative, unbiased data sets. We have started this large scale program because artificial intelligence is where it is used primarily in the diagnostics, cancer, you name it, tuberculosis, you name it, different diseases, it is being used. So the data which is used for training those models, we are trying to develop those standard data sets. We are trying to do what we are labeling is a gold standard data sets. So in collaboration with Indian Institute of Sciences and many other national institutes, good national institutes like AIMS, PGI, SGPGI, we have started a large scale program where we are developing thematic thematic gold standard data sets. And the institute which is responsible is we label it as thematic hub. And then there are different spokes associated with that institute to give it a nationally representative data sets. So I think the major challenge that we are going to face is the differentiation or demarcation between the real and the generated data sets. And then we can think of developing excellent models and all that.
Thank you, Dr. Harpreet, for taking us ahead, because it is, while it may seem like a futuristic challenge, I'm sure it's right around the corner, and it's something we need to start thinking about already. And my next question to all of you really, and this is something we've discussed several times in RESPIRE as well. So as you know, RESPIRE is a multi-country partnership. We work in 7 countries. In each country, we have 4 or 5 partners. And oftentimes studies are multi-country studies. So there's a lot of expectation, there's a lot of requirement to kind of share the information, to work together. So in your experience on big projects, when you have government, non-government agencies, when you have national, international, and local partners together with the local data being generated, how do we address this as component of data sharing? What are the do's and don'ts with respect to you? Of course, every setting has rules and regulations in place. But in your experience, what should be the best practice for data sharing, especially when we're working with very sensitive data, when we're working with data from indigenous populations or vulnerable populations. So we'd be really curious to hear your take, your advice on this. Dr. Amrita Misra? All right, we'll ask Dr. Misra to join in when she can. Dr. Misra, are you able to respond?
I'm sorry, you were asking something. This is really bad.
Sure.
You were asking something about the.
So yes,
sorry.
The question really is about, we have multiple partners, stakeholders, government, non-government, international, local. How should we approach data sharing with so many partners involved, so many agendas involved? What are the do's and don'ts in your experience with respect to data sharing?
Yes, absolutely. So multiple partners require different levels of data. Whether it's the donor you're sharing with, whether you are sharing with the government, or you are sharing with, let us say, the community, or you're sharing with implementers, the kind of data you need to share is very different. Obviously, you understand what is relevant for that particular person. And I also feel that data visualization has become extremely important. How you share the data, whether it's in the form of a dashboard for implementers or policymakers, data sharing is better in the form of a dashboard. One thing we don't do at all is sharing data back with communities. We gather all data from communities and we share nothing back with them about their own situation. In fact, when we work with communities very closely, we feel this backlash and again that you came yesterday also and you asked us last month also, what did you find? So we should keep in mind that when we are collecting data from someone, it is our duty to also get back to them with our findings, share it with the community, share it with the panchayat, share it with the village leaders. Yes, what did you find about your village? So how do you present data to share with different stakeholders? What is the relevant data for each kind of stakeholder that should be sorry, kept in mind? And this complete absence of data sharing with community, that bridge also should be made moving ahead.
Thank you. Thank you, Dr. Amrita. Dr. G.K. Soni, if you'd like to chip in, please.
Yeah, I think data sharing is equally important also between the development partners who are working for the same goal. I am aware of the immunization partners who are working. If we will not share data with each other, I think if we are working in the field, it should be a collaborative effect instead of doing individual work. So everyone is doing the work in the interest of the program, in the interest of the community, and the interest of the public health. So data sharing has to be there, but the government should be in the loop, because the government data is not the personal data and the individual. If any of the stakeholder has collected data, that is for the program improvement. So keeping the government in the loop with the consent of the government, the data common indicators can be shared with each other, so that the actions can be taken in the community based on the data generated by X agency. So Y agency can also use the data to improve the program, and that will be added advantage for the program point of view instead of generating fresh data. Otherwise, every partner will go and start collecting the information which is already available if some other partner has done. So I think we should have a system of data sharing, but if it is a public data, if it is a government data, government has to be in the loop to utilize the data, because ultimately it's the government who is going to implement. The partners cannot implement each and everything. So owning of the data should be the system should own the data, and I think there should be a regular feedback system for activities. Oh, thank you.
Thank you, sir. Dr. Harpreet?
Yes, Dr. Genevieve. Again, here the $1 million question is, whose data? Who is the owner of the data? So owner is, as per this recent DPDP Act, is the individual whose data we are talking about. Is the owner. Rest all, we are custodians. There are different fiduciaries and all. There are different terms for that. So with this internet, because most of these data owners, they are not aware of their rights and their what you call responsibilities and all. So first thing is, I think we should increase the awareness. Then there are two levels of data we are talking about. One is at the individual level, and second is the aggregate data in terms of aggregate numbers or models or different forms of data. So if we're talking about individual data, sharing of individual data should be done as per the laws of the legislations of the country. We have laws, this European Union have their GDPRs, America has their own laws. So different countries should share data across the boundaries following the laws. There are agencies which are designated to handle those kind of requests. So that should be compliant. If you ask me as a technical person, this anonymization, it's a very gray area. Anonymization has to be done properly. And then sharing models, people say that models and aggregate data, they do not carry any PIIs or any identifiable information. But again, there are many, I would say, indirect PIIs associated with models and these other aggregate data. So we have to be very careful on that. So another thing that I would like to stress here is, since you are looking at RESPIRE, this data can be shared if we have strong agreements in place as per the legislations of the country. And those agreements should be focusing not just on the data sharing, but should also be focusing on the intellectual property, which is data or generated from the data. It can be direct or indirect intellectual property, because ultimately we should be in a position after giving data, after using data, reusing data, in a position to give back to the community or to the individual whose data it was. So ultimately, it boils down to the same question: whose data and what benefit is going to get out of it by sharing.
Fantastic. Thank you, Dr. Soni. And this is a lot to really take in. And I know Tapas and I, when we will be looking at this recording, there'll be a lot of lessons to unpack from this. We've got about 7-8 minutes. And in this final segment of this panel, I really want to ask everybody, in terms of any key lessons or any take-home lessons that you want the RESPIRE researchers and all our members who joined us to go back with when they go back to their data sets, when they go back to their data management practices. What are the top 2 or 3 lessons? Of course, you've shared a lot of lessons, but anything in addition to those, if you'd like to share in this last phase of our panel. Dr. Amrita? Maybe I can ask Dr. G.K. Soni to start and then invite Dr. Misra to follow on.
Sure. Thank you. So I think, according to me, data which we are utilizing, it should be correct and easily retrievable, what I have already mentioned earlier also. And it should be actionable. So basically, and there should be some review mechanism at a different level who can ensure the data which is collected is correct and complete. So some review mechanisms, some review committees have to be there at different levels who can ensure the data collected is correct, and the privacy, what we have discussed regarding privacy and security, and that needs to be maintained at the different level. So I think from my point of view, there should be regular review of the data, either in the monthly meetings, or the system should be there in the place. If their data has been entered, who is cross-checking that data? Someone should be there, either a small committee has to be there before finalizing the data, which is entered at the web portal or whatever it may be. Someone should check the data for the correctness and completeness. And capacity building of the staff has to be there, because there are frequent changes in the data collection. Newer things are coming, newer technologies are coming. So the capacity building of the staff has to be strengthened from entry level to the nation level, because everyone is using in the data at the different level. So their capacity needs to be strengthened. Even if we are going in the technology point of view, we are having digitalization each and everything. But the data, the staff who is entering, whether they are cumbersome with their data or not, they are able to understand what needs to be entered in that. So I think at the grassroots level, the capacity needs to be built effectively. Over.
Thank you, sir. Very important lessons. Dr. Harpreet?
So again, as I said previously, for researchers and for our RESPIRE fellows, they should follow first, and very important lesson is should follow standard data management practices, which is going to ensure that the data is of high quality and is reusable. So there are many aspects of standard data management practice, which I think is a lesson or a chapter or a discussion in itself. We have to get hours and hours on that. And there are a lot of confusions about the legislation, even GDPR, HIPAA, and now this DPDP Act. So second lesson is the researchers should be aware of those legislations, should not fear, should try to comply to the policy guidelines and legislations. This is what I have seen with many researchers. The first thing they start is with fear that this is going to kill us or going to give us something which is not desirable. So I think awareness is the second lesson. They should get themselves aware of the rules, regulations, nitty-gritties, policies, and how to make those because those acts are not to restrict the research. They are to facilitate ethical conduct of research, a more structured conduct of research. So two messages I am giving, not just one: standard data management practices and comply with the policies, legislation, and guidelines.
Thank you, Dr. Harpreet. Very clear and very clear points for us to focus on. Can I ask if Dr. Amrita can add her key messages for the group here?
Yes, thank you. So I think the eminent panelists have already added a lot of good points. Just a couple of things from a community perspective, I would like to point out, I mentioned earlier, that the data, who is important to, where are you getting it from, that you must be responsible towards the people who the data actually belongs to. And it is data is actually statistics. It is information about somebody that you are gathering, and you should feel ethically responsible towards that particular person. That's one, which will motivate you to keep data privacy, ensure data privacy, and ensure respect for that particular data set and how to use it. The other issue is, the HR quality. If we want to get good data quality, we have to invest in the people who are actually collecting data. I think data management needs more investment and more streamlining, more thinking through, more technology usage to make it, to improve the quality of it, perhaps low-cost technology. There is more need for low-cost technology to streamline data gathering as well as to ensure back checks and quality of the data. Of course, however much AI you may have or technology you may have, it is the human being, after all, who's going to actually collect it. So invest as much in that particular person who's going to help you with that data. So those would be my points.
Thank you, Dr. Misra. And I think now I would like to really use up all of the remaining 15-20 minutes to take questions from our audience. So Tapas, if you can come back online and then we can moderate the chat box. I want to invite all our members who've joined us. We've got about 47 people in total on this call. Please send us your questions in the chat box, or please raise your digital hand. And if you want to ask a question to a specific panelist, please say so. Introduce yourself, where you're from, your question, and for whom the question is. And if it's a general question, please say so. It's a general question. We'll try our best to get as many questions taken into this panel.
Maybe so one thing that I received from Dr. Rutuja, who is the senior scientist at KMHRC. So she went to another meeting, so she sent her question. So I'm just going to read it. She is asking if there is data generated by Indian RESPIRE partner only using a questionnaire about knowledge of TB, and if it doesn't have any identifier of the study participants, and if there is a central data server situated in Edinburgh, is it possible for Indian partner to use the Edinburgh server to store the data? And she also clarifies, definitely through an agreement where the data are not used by Edinburgh partner with our written permission from Indian partner. Is this allowed?
So can I ask the panelists to chip in? I mean, I hope the scenario was clear. There is data, TB-related data from India, Indian partner agreements in place. There is a central server in Edinburgh, UK. how do we go about this? Is this sharing, right, Tapas? Yeah. Please, panelists, feel free to chip in and share your perspective on the question.
So, Genevieve, I think my take on this question is, you said agreements are in place. And I sincerely hope that those agreements have been approved by the appropriate agencies. Because if we want to use any server outside India premises, there are legal challenges on that. So if this data which is stored, I'm just omitting out that agreements are in place. If the data is staying on some other foreign country, the rules of India doesn't apply there. So if anything happens, there is a problem. So this is, I'm not a legal person, but this is my common understanding. So even if you place agreements, those agreements or those contracts have to be approved by the appropriate agencies, government agencies. There is a process, set process to do that. And I sincerely wish that they have followed that process and completed all the legal requirements.
Thank you. Dr. Soni, Dr. Misra, any comments on this question?
Yeah, I think if we do echo with Dr. Harpreet, there are set norms which needs to be followed for the data, because again, the confidentiality of the data is there, privacy of data is there. So if it is within the country, I think it can be easily, government has the control of that. But outside the country, they don't have any control. So I think I do agree with Dr. Harpreet. I echo with him. Yeah.
Dr. Misra, I think you're muted.
I'd like to say the same. Yes, of course, totally echoing with families.
Thank you. So hopefully that's very useful advice for Rutuja, for our colleague who's asked this question. Are there any other questions that colleagues in the group would like to ask? If you can please raise your digital hand and let us know, or send us the questions in the chat box.
GDP, I guess from KMHRC Vadu team, Rashid is there. So he has some questions, please.
Okay. So, hello everyone. This is Rakesh from KEM Pune. So, this is a very general question based on the practical aspect. So, in most of our study, we do data collection on paper first and then transcribe into the electronic form. And recently we have started directly capturing on the electronic form. So both the methods have their advantages and the disadvantages. So in your opinion, what is the good approach for the data collection and data management? Is it a paper and then transform into the electronic form, or directly into the electronic form?
So
Thank you,
Doctor, if you take my advice, the second option is the best, directly on the electronic form. Because there are chances of number of places where errors can creep into your database, corrupt your data. So direct electronic transfer is the way, go ahead. But only thing is, when you develop such kind of applications, you have to be aware of the government rules on that. There is an agency called CERT, Cyber Emergency Response Threat Team of the Government of India. Any application which is developed by either a government agency, mostly from the government agency, has to be security audited by CERT. And then there is also another agency called STQC. So your data premises, your data center, or the place where the data is going to be stored has to be certified by STQC. So there are a set of procedures for doing that. If you follow that, then everything is safe. But means I would not say 100% safe, but at least you are quite safe if you follow those procedures. So electronic is the way forward, but with careful, complying to all those rules. Yes.
Okay, thanks.
Do any other panelists have any additional comments to make to this question?
I think it's fine. Data entry will prevent data entry errors, which can happen at multiple levels. So if data has been entered at the grassroots level, I think the transmission will be easy, but definitely there should be some checks and balances And the security is what Dr. Harpreet has mentioned, that has to be there. So we can prevent the human errors which are there at the different levels if it is transmitted later on.
So, Dr. You are not alone. I am right now working with the agency. I'm not going to name it. Very interesting, problem I'm facing. I'm taking something from the electronic media, then putting on my own handwriting, and then that my handwriting is going to be transcribed by some transcription person. So I'm not my handwriting is very, very bad. So you can understand the amount of errors which are going to creep in. So electronic is the way forward.
That's very helpful. That illustration makes it even more effective to convey the point. And if I can move to another big question that we've got from a panel, from our member Famidur Rahman from ARC Foundation in Bangladesh, who asks a very big question: how can we mitigate or prevent risks during data management? Risks that can arise with quality, security, misinterpretation, missing data. How do we manage risks? Over to the panel. Dr. Misra, would you like to go first?
Yes, I think the question is, I think it's a summary of today's discussions, actually. All the various points that have been mentioned in the question have been discussed separately. So, of course, quality issues, if you look at quality issues, there are, you have to have fact checks, you have to have good data collectors, you have to ensure that the data collectors are motivated and get good quality, complete data in the first place, and regular checks of the data. So it has to be checked through technology, and it has to be also checked while it is being collected. So the entire process of data collection, whether you are doing it manually or whether you're using a tool, has to be done. Security concerns, of course, Dr. Harpreet has mentioned many possibilities of how to ensure security. Data misinterpretation is, of course, an issue, but if you are careful about who you're sharing the data with, who is the owner of the data, who is the user of the data, which is one of the reasons why we were talking about not opening data sets to everybody. Because there's a strong possibility of misinterpretation when you open data sets to everybody. So provide access only to those who will use that data effectively and constructively. Of course, missing data is part of quality issue. So keeping that in mind. So this is actually the entire chain of data management that has been posed. And I think as we went through this entire panel discussion, many of these points were addressed. So I hope I've been able to summarize those.
You have. Thank you so much, Dr. Misra. Can I ask Dr. G.K. Soni if there are any other things that we might have missed with respect to addressing risks in data management?
I think most of the things have been covered. Definitely, there are multiple risks. Security concerns is very important, the confidentiality of the data and the misinterpretation, like Dr. Amrita has already mentioned. Anyone can misinterpret the data if it is available public domain, because they cannot link the data. There is a linkages of data from different sets also for interpretation also. We cannot directly, whatever the data we have collected, we have just interpreted that. So there is cross-linkage, triangulation data is also important to come to some analysis also. So rightly mentioned earlier, if we are sharing the analysis, so that will be helpful instead of giving the raw data to anyone. So yes, definitely we have to take care of the security concerns and interpretation. So if we are doing for missing data, the quality of data has to be there. Some quality checks has to be there for the missing information or incomplete information which is there. That can be in the manual form also, that can be in the digital form also, if someone has skipped. So some checks and balances can be put even in the detailed form also, so that they cannot move ahead. Or if they're entering data, some alerts can be raised immediately to them with the use of technologies. So at least at that time in the electronic form, we can have some checks and balances at the entry end. If some wrong entry is coming, AI can help them now. Okay, this is if one or the two digits have been put extra, I think someone alerts can be there. Yes, it is not acceptable. But in manual, we can write any in number like that. So there are some challenges for each and everything. We have to balance out the things as per the need of the program.
Thank you, Dr. Soni. Thank you. Dr. Harpreet, anything that we may have missed? And I'm sure you will have a lot to add to this.
No. I only have to add that if you really want to prevent or misuse of data or loss of data or go ahead with the proper structured collection and management and analysis, we have to follow the guidelines and we have to follow the best practices. So that's what I have to add here. Yes.
And I know we've got two more questions. I'm going to read out both of these questions for the group. The first question is, does data management plan need approval by an ethics committee or a regulatory authority? That's the first question. And the second one is, how can we prevent data loss if we are collecting data only on electronic systems? So the first one is the ethics question. Does it need ethical approval? And the second one is data loss, prevention of data loss.
First question is regarding data management plans approval by the ethics committee. Right now, I am not aware of any regulation which talks about, I'm not even aware of a funding agency which talks about data management plan to be submitted along with the proposal. So I'm not in India. I'm talking about in India. And ethical clearance, yes, we have to take approval from the ethics committee if we are going to use data. But the document is not data management plan. The document is complete proposal that needs approval from the ethical committee. And your second question was about data loss. I suppose how we can prevent data loss. So again, there are standard practices. If we follow, there is no data loss. Standard practices are a very, very huge document in itself. But if one learns, I think if one learns even 4 or 5 points of the document, it will be really helpful. Yes.
Dr. Soni, Dr. Misra, any additional comments on these two questions?
I think Dr. Harpreet has covered. But regarding data loss, what I am able to understand, if it is in electronic form, if system get crashed, what will happen? In manual form, you have the raw data with you, you have the papers with you, which you can utilize further also. If the concern which was raised by the team member who were there, I think, yes, we should have some backup system. A regular backup system has to be there to prevent such data losses in case, because in technology, anything can happen. Usually we are able to see our hard disk get crashed. Then what to do? How to recover that data? So yes, there should be a standard operating procedure for data entry and everything, but there should always be a backup system. Plan A and plan B has to be there to safely have the data with the system. Either it can be placed on the servers or something like that. But again, security concerns will be there. So we have to see, everything has a pros and cons. And similarly for the data security also and data entry also. Thank you.
Thank you, Dr. Soni. Dr. Misra, would you like to add any additional points to this?
No, I totally agree. Yes, we must have a backup system when we are collecting data electronically, and many of us have experienced technology outages at the last minute. So while we depend a lot on technology, we cannot depend exclusively on it. So some kind of a backup system while you're collecting data, continuously backing it up would be very important to prevent any kind of data loss, plus continuously checking that you are getting all the information filled up. Many of us, what we do is when we collect data manually and then get it entered into the system, and that's where we lose data from the manual to the electronic. But if we are collecting data directly electronically, that will also help in preventing data loss.
Thank you, Dr. Misra. I have one question for the group. This session has really helped to simplify and democratize this whole knowledge around data management and really reduce the fear, as Dr. Harpreet was saying, around these practices. They're straightforward and they're meant to facilitate us to do ethical research. So, and this is something that Tapas has also mentioned about setting up a methodologies network, or rather a group of researchers who are working on data management or who have to do data management as part of their work. So in your experience, does any kind of a network like this exist, maybe at the regional level or the national level? Or if it doesn't, then what should this network look like? What should it do? Should it be an online group of people coming together and meeting annually? So really looking for some ideas and guidance from the panel about some kind of a network of researchers working in data management.
I do believe that such networks exist of M&E specialists and people who are managing data. I would love to connect you with some groups if my CML team, our CML team would have such network connections. But offhand, it's difficult to say. I'm sure others can add.
Dr. Soni, any suggestions?
I think it's same. We haven't heard anything, especially for the data at the country level, especially. But globally, I think momentum knowledge accelerator is there, who's looking after all the data, MLE actions, and something like that. So they are working for the data system across other countries also. So one of the component what we are able to come across during my project cycle also. So MK is there, momentum knowledge accelerator, who looks after all the data and what are the new things have been developed, the innovations developed in the digitalization or in the data. So the team, MK team works at the moment on global level, I think, but not at the country level like that. We haven't seen any MLE functional or data. I haven't come across in my life as of now.
No, but that's very helpful for us, for Tapas as well, to take a look at this existing network framework. And if there's something that we can replicate to begin with at the RESPIRE level, we've got data management champions and from each partner, so we can bring them together and use a similar framework. And thank you to Dr. Misra as well for your comment. Dr. Harpreet, have you heard of any networks or any advice or suggestions for us as we begin to think about forming this network? I think, Dr. Harpreet, you're unmuted. You're muted. I think he's. I'm sure every one of you panelists are really busy people right now, so that's completely understood by us. I think we're nearing towards the end, Tapas, towards our question and answer round. And if you do have any other questions, please send them to Tapas, and we'll try and pass them on to our panelists and get their advice. But if I can ask Kitty, if I can request Kitty to please share a link in the chat box. If you can please take a look at the chat box, there's a link to a very, very short feedback form. If you can just open that and keep that tab open for later on and just spare 1 or 2 minutes to complete this form, it'll give us a chance to get to know you, your email addresses, and share further updates with you. And I really want to thank, on behalf of RESPIRE, our directors, our entire team in all the 7 countries, I want to really thank all of you, Dr. Amrita Misra, Dr. G.K. Soni, Dr. Harpreet Singh, as well as Dr. Sujeev Ranjan, who'd agreed to come, but I'm sure he's caught up somewhere. But I really want to thank you all for your time, your guidance, for taking part in this very, very practical, very honest conversation and giving us so many lessons to take home. We will be going back to this recording, putting together a list of lessons and sharing it with our wide RESPIRE family. Thank you so much for your time. And I'd like to hand over to Tapas for the next bit, the final bit of this webinar. Thanks, Tapas.
Thank you. It's such an honor to present with such kind of senior expertise with whom I have worked earlier. Without taking much time, I would like to hand over to Dr. Anand, who is the head of the Vadu Rural Health Program, which is a part of KEM-HRC Pune. So, Dr. Anand, over to you.
Good afternoon, everyone. At the outset, I'm extremely sorry and kindly accept my apology that I could be able to join so late and to just say thank you to you. But I was stuck in the another meeting, so extremely sorry, Dr. Misra, Dr. Harpreet, and Dr. Soni. But I could fortunately able to join in during your question and answer session, and I find it that with the quality quality of the questions and the answers by the expert. I know that this session has been, as Genevieve correctly say, you are making the data management per se, and lot of fear which was in everybody's mind whenever we talked a word like data management. Everybody is scared of, and now with these sessions, I think with such a simplified answers, we had some fear is lessened down. So thank you very much, everyone, Dr. Misra, Dr. Soni, Dr. Harpreet, for such a excellent session and giving so much simplified answers to the questions. Genevieve also making such a wonderful moderation of the panelists and everything. So thank you very much. Thank you everyone for joining this seminar, and I'm sure you know as even as one of the component like data security, it itself has a topic of webinar, a single webinar. So I think if you can take further and having the webinars on different component of like data sharing, like privacy, like all this itself has a this. And I think that now the RESPIRE has taken lead in that. And if at the end, if we can already, probably, I guess you have in the process of making that document, sub guideline for the comprehensive data management across the site, or some guidelines, some documents. So that will be very useful for the researchers, as you say, because there are not so clear-cut guidelines what to do, how to do. These are still the questions the researchers face. So in that perspective, I think that today's webinar is very fantastic, and it shows those pathways to the further what we can propose in the data management thing. So again, at the last, I'm very thankful to RESPIRE for making this effort, and all those who have joined and making this webinar successful. I just can't thank you to Tapas for, and Genevieve, you also, for making all those things. And thank you everyone for joining. So thank you very much. Thanks.
Thank you so much, Dr. This wonderful closing remarks. So I think we are at the end of our webinar session. So thank you all for joining us today. And if you have any further questions, like Genevieve said, you can get back to us so that we can have the clarification. And as Dr. Anand suggested, we can have some follow-up domain-specific discussions at a later stage, and we can take the guidance forward. Thank you. Thanks a lot.
Thank you so much, everyone. Please take care, and we'll be getting in touch with you with some key lessons from this session, and hopefully organizing many more sessions like that in the future. Huge thanks to our speakers and our RESPIRE team. Take care, everyone.